Hello and welcome. Have you ever experienced that familiar scratchy throat, the persistent sneezing, and the overall feeling of being under the weather? Chances are you've encountered the common cold, also known as viral rhinitis. While usually mild, it's one of the most frequent illnesses worldwide. Today we'll delve into the world of the common cold, exploring its causes, symptoms, treatments, and prevention strategies, offering a comprehensive understanding of this ubiquitous ailment. The common cold is primarily caused by viruses, with rhinoviruses being the most frequent culprits. However, other viruses like coronaviruses, adenoviruses, and respiratory syncytial virus, or RSV, can also trigger a cold. These viruses enter the body typically through the nose or mouth. Often after you've touched a contaminated surface or inhaled virus-laden droplets released when an infected person coughs or sneezes. There are over 200 different viruses known to cause the common cold, which explains why you can catch colds repeatedly. Once a cold virus enters your body, it targets the cells lining your nose and throat. The virus replicates inside these cells, causing inflammation and irritation. This triggers your immune system to respond, releasing inflammatory chemicals like histamines and cytokines. It's this immune response, rather than the virus itself, that largely causes the symptoms of a cold: nasal congestion, sneezing, sore throat, and increased mucus production. The increased mucus production is the body's attempt to trap and flush out the virus. The common cold is incredibly widespread. It's estimated that adults typically experience 2 to 3 colds per year, while children can get them even more frequently, often 6 to 8 times annually. This is because children have not yet developed immunity to many of the cold viruses. Colds are more prevalent during the fall and winter months, possibly due to increased indoor gatherings and the survival of viruses in drier, cooler air. The symptoms of a common cold usually develop 1 to 3 days after infection. The most common symptoms include a runny or stuffy nose, sore sneezing, coughing, mild fatigue, and a low-grade fever. You might also experience headache, body aches, and a decreased sense of taste or smell. It's important to note that these symptoms are typically mild and self-limiting, resolving within 7 to 10 days. If symptoms worsen or persist beyond this timeframe, it may be a sign of a secondary infection, such as sinusitis or bronchitis. Diagnosing the common cold is usually straightforward and based on a clinical assessment of your symptoms. Typically, no specific testing is required. However, in certain cases, such as during a flu pandemic or if symptoms are severe or prolonged, a nasal swab might be taken to test for influenza or other respiratory viruses to rule out more serious conditions. While there aren't distinct types of the common cold based on specific viral strains, we can broadly categorize them based on the dominant virus causing the infection, for example, a rhinovirus cold or a coronavirus cold. However, the resulting symptoms are generally similar, regardless of the specific virus. Unfortunately, there's no cure for the common cold. Treatment focuses on relieving symptoms and supporting your body's natural healing process. Rest and adequate hydration are key. Over-the-counter medications like decongestants, antihistamines, and pain relievers can help alleviate symptoms. Decongestants reduce nasal congestion, antihistamines can help with a runny nose and sneezing, and pain relievers like acetaminophen or ibuprofen can ease headache and body aches. Gargling with warm salt water can soothe a sore throat. Remember to always follow dosage instructions and consult with a healthcare professional if you have any underlying health conditions or are taking other medications. Preventing the common cold relies primarily on practicing good hygiene. Frequent hand washing with soap and water is crucial, especially after being in public places or touching surfaces that others may have touched. Avoid touching your face, particularly your eyes, nose, and mouth. Cover your mouth and nose with a tissue when coughing or sneezing, and dispose of the tissue properly. If tissues aren't available, cough or sneeze into your elbow rather than your hands. Maintaining a healthy lifestyle, including getting enough sleep, eating a balanced diet, and managing stress, can also help strengthen your immune system and reduce your susceptibility to colds. The prognosis for the common cold is generally excellent. Most people recover fully within 7 to 10 days without any long-term complications. While the common cold is usually benign, researchers continue to explore ways to better understand and combat cold viruses. Current research focuses on developing antiviral medications that could shorten the duration of a cold or reduce its severity. Scientists are also working on vaccines that could provide protection against common cold viruses, although the sheer number of viruses involved presents a significant challenge. Understanding the intricate workings of the immune response during a cold is crucial for developing effective preventative and therapeutic strategies. While a cure for the common cold remains elusive, ongoing research offers hope for improved management and prevention in the future.